International Association of Yoga Therapy in United States of America, and it's a very strong body, and they train people. They are all over the world. I'm happy to be one of the accreditation program review committee member for them. So I start using this therapy because I was trained in this in all neurological disorders and medical disorders, both for prevention as well as for treating these patients. Additional measure is cost effective. It has a lot of benefits, which I will discuss. And I thank Dr. Magesh, the Rare Disease Subsection Vice Chair, for being here and also giving a talk. And today is a Rare Disease Day. People always ask me when I taken over the position that what is rare disease? Everything is, could you name more or genetic? It's not like that. I think the rare disease by itself can be rare, but there are so many rare diseases. People are telling almost like millions of people are affected with this rare disease all over the world because so many rare diseases are there to be treated, not only genetic, apart from non-genetic disorders also. So today I'm going to focus only on yoga therapy in Parkinson plus disease. So I just want to talk one or two slides about Parkinson, even though I know all of you are experts in that. Parkinson plus syndromes or atypical Parkinsonism are progressive neurodegenerative disorders that mimic Parkinson disease, but feature faster progression, poor response to levodopa, yearly falls, dementia, and autonomic failure. We know that we treat people with Parkinson disease with medication, they do better, and we are happy, patients are happy. But when you get a Parkinson plus disease in the clinic, it becomes a very difficult situation. We give medicine, they do not respond. So this kind of therapy, yoga therapy, in addition, we teach to the patient, they feel happy. So that it look like as so that a lot of holistic care is going on to the patient management. The key characteristic symptoms are rapid progression, generally faster decline and shorter life expectancy than classic Parkinson disease. Yearly balance issues, they fall frequently due to instability, poor medication response, little to no long-term improvement with Parkinson drugs like levodopa. The additional symptoms are yearly dementia, cognitive deficit, severe autonomic dysfunction, blood pressure, bowel bladder issues, gaze palsy, or alien limb phenomenon. And there are things which we can help by yoga therapy. People are anxiety. Anxiety is a common treatable non-movement symptom of Parkinson disease. It can appear before or after diagnosis and is linked to the same biochemical changes. It may be triggered by off periods, isolation, or the stress of managing PD, and can cause physical, emotional symptoms such as racing thoughts, panic, irritability, and sleep problems. Medication adjustment, therapy, mindfulness, exercise, and social support are the important therapeutic measures. And second thing is the shortness of breath in Parkinson can result from wearing off. You would have seen people when the drug effect is going off, or they develop dyskinesia, or they develop anxiety, aspiration pneumonia, or other health condition. They feel breathless. They may be coming to the clinic and say, I have shortness of breath, I'm feeling breathing difficulty. The treatment include adjusting the medication, addressing the anxiety, treating infection, and speech and language therapies for the swallowing issues. Coping strategies are staying active, stress management, and quitting smoking, and address non-PD causes. But this meditation pranayama has a lot of benefit in people with respiratory difficulty and anxiety disorder in Parkinson plus disease patients. The Parkinson disease has many features that have little or nothing to do with the movement. Among these are non-motor symptoms or problems with the autonomic nervous system, the part of the nervous system that controls automatic bodily function like heart rate, blood pressure, sweating, sexual function, GI and urinary function. All these things can some benefit of doing this kind of yoga interventional measures. These symptoms are often among the most serious and complex issues faced by the people with Parkinson disease. Then the bowel dysfunction like constipation and urinary dysfunction, some other Parkinson plus disease like multisystem atrophy and all those things. So now we come to the yoga therapy. What is yoga therapy? Application of yogic methods for healing of diseases. It is simple, it is not expensive, it is scientific, it has a preventive role as well. And we always feel that there are people practice yoga therapy all over the world, and they are on par with the in additional therapeutic measure to the patients, and they are paid off well for all this intervention to the patients. So it's becoming it has a worldwide organizations, and they do a lot of work, and they have index journals, International Journal of Yoga Therapy, and so many journals are available on yoga therapy all over the world. And proper relaxation is very important for practicing yoga therapy. Patients should not be very tight. In Parkinson plus disease, they are very stiff. That is one of the difficulty in doing, but we can do what best we can do to the patient. By continuous work, the natural efficiency of the body and mind diminishes. Rest and relaxation gives the body a chance to recharge. And yogic methods give this. I think it is everyone should practice meditation yoga, because all of us are going through a lot of stress every day. Yoga has many benefits to the body, mind, and improves the well-being of a person. It improves the strength of the muscle and tone. It improves the balance, posture, and flexibility of joints. Deep breathing and relaxation methods reduces the anxiety. So, as I was telling initially, the incidence of anxiety in Parkinson plus disease or any Parkinson patient is around 40 to 68%, quite often common. And sometimes the medication makes them drowsy, they may fall again, they may crack the bone. So all these things, method like meditation, all these things will help these patients. In meditation, attention is focused and unnecessary thoughts are controlled. It helps to enhance physical and emotional well-being, improves the body-mind coordination. There are different types of meditation, like guided meditation, chanting meditation, mindfulness meditation, and transcendental meditation. I teach all my patients the Om meditation or Awe meditation, and there is a Buddhist meditation called Om Ah Om Om. And Om meditation also, you should focus more on the vibration rather than on the sound of the meditation. Like Om. Vibration travels all over the body. It has a lot of healing effect on the body. It is only sound of the space. It is not. Sometimes people say that it is a sound of the space. It has a healing effect of the body, because the space has a resting sound, and people say this Om is the resting sound of the space. It lowers oxidative stress, lower blood pressure, enhance pulmonary and nervous system function, improves the mood, sleep, and quality of life, and reduce medication use. It has a lot of benefit, additional benefit. So pranayama. Prana is the life energy, yama is control. Prana means our life energy is breathing. So breathing control is pranayama. There are many types of pranayama. Breathing awareness is a kind of meditation practice. Most of us don't practice breathe well. There are people practice only half of the lung volume, and they feel breathless. And one of the common cause of the breathlessness is not only asthma or cardiac problem or any other medical issues. One of the people don't breathe well, also one of the common cause of breathlessness when they exert. There are many ways of doing it: hands in and out, hand stretch method, and ankle stretch method. People can take a slow deep breathing and slow deep breathing out. In all these methods, one should breathe in and out slowly and deeply. We should not do it very fast. We should not do it very roughly. It should be very, very gentle, and the lung should expand slowly and should deflate slowly. Along with above breath awareness methods, one can do stretch exercise like spinal stretch, lateral stretch, and twisting movements at deep level. So the Nadi Siddhi Pranayama, that is alternate nostril breathing. After particular age and people with a cardiac disorder, they should not hold the breath. They should only do alternate nostril breathing. It balances the energy flow between the right and the left side of the body. For example, that you can use a Vishnu Mudra, block the right nostril, inhale, lock and exhale. Inhale, lock and exhale. It's called Nadi Siddhi or alternate nostril breathing. It opens a nostril block, very common problem, and the lung will expand adequately, and oxygen concentration in the body improves, which ultimately improves the cognition and health status of the body. Nadi Sodhana Pranayama is holding the breath. It's can be done by young people, but I think Nadi Siddhi is very safe for every age. Bastrika is bellows breath. It is more advanced pranayama, like other pranayama should practice in empty stomach. Bastrika is very simple method, is keep the arm close to the chest while going up, inhale, coming back, exhale. Inhale and exhale. And Sitale pranayama, Sadanta pranayama are advanced pranayama, but it's not very difficult. For example, fold the tongue, suck the air, close the mouth, exhale through nose. And this Sitale pranayama also very helpful in breathing disorder, people like obstructive sleep apnea or central sleep apnea. It improves, it stimulates the breathing apparatus. It also improves the intraoral pressure. It has a lot of benefit to the body. Sadanta pranayama is closing the teeth, suck the air, close the mouth, exhale through nose. Like that. And Kapalpati is a short, rapid expiration with normal inspiration. And you don't need to do with a lot of force. Just keep the arm above while coming down, exhale. What happens is the sinuses drain through the nostril, and the muscle between the lung and the tummy called diaphragm becomes stronger. So in Kapalpati means shining skull. And Brahmari Pranayama is humming bee breath. It is done with Shanmukhi Mudra. Brahmari Pranayama is practiced in India for thousands of years. People say it's practiced up to 5,000 years. Brahmari means black bee ringing sound, Brahmari Pranayama. For example, you keep the thumb closing the ear lobule, spread the finger across the face, make a humming bee noise. Some people do continuously, but it may strain your throat. So if you have intermittent landing note, then you feel comfortable. It makes the brain to secrete neurotransmitters. It gives mind peacefulness. It improves the sleep. It improves the memory. It improves the immune status of the body. It improves the voice quality. There are many singers practice Brahmari Pranayama before they go for singing. And bandhas means to lock. There are 3 types of bandha. Mula bandha for strengthening the pelvic floor muscle. Uddiyana bandha for abdomen and diaphragm. And Jalandhara bandha for stretching the throat region. Jalandhara bandha is you need a lot of training, and you need a guru to teach you. And that improves the stretching of thyroid, and it makes the thyroid to secrete better. And Mula bandha is like Kegel exercise. And the people has to contract the pelvic floor muscle and hold it for some time, then they have to relax. And it has effect on the strengthening the pelvic floor muscle, because one of the common problem in Parkinson plus disease is constipation and urinary incontinence in multi-system atrophy. And it has a lot of effect on pelvic floor strengthening, strengthen the pelvic floor muscle. It has a benefit to the both bowel and bladder issues. The effect of yoga on patients with Parkinson disease, a lot of study. You can go to Google or PubMed. You get a lot of study on effect on these Parkinson disease patients on the yoga, the anxiety management, and breathing difficulty, and bowel bladder disturbances. A lot of study available. Cochrane data is available, and it has found to be improve the motor function, balance, functional mobility, reducing anxiety, depression, and improving the quality of life of the Parkinson disease patients. Yoga prevents gray matter atrophy, and it is a woman risk for Alzheimer disease. And it has improved effect on the depression, resilience, memory, and executive function. It increases hippocampal choline concentration, modulate the brain connectivity. So a lot of benefit. So pranayama is control of breath, the ancient breathing technique I mentioned about, and many Western countries routinely implement this in practice in the hospitals also. There are yoga therapists available in the hospitals. And I told you about the Nadi Sudhi, and these are all some of the aspects that how old these techniques are. And one thing is, when you do pranayama, always do pranayama in the empty stomach. Morning is the ideal time. Stomach should be free from food for minimum 3 hours, or even if you are doing night, and make sure the stomach is free from food for 3 hours. So morning is the ideal time. If you do 5 minutes, it's also quite good enough. It has a lot of impact on the health of the body, and the place should be free from the distractions. And the body should be upright, and muscles should be in a relaxed position, and eyes closed, because so you will not be distracted. And as I told you, should not practice immediately after food. And the common asana used to Padmasana, Vajrasana, Swastikasana while practicing, or if people have difficulty in sitting in the asana position, they can sit in the chair and do it, called chair yoga. And I told about all the pranayama techniques. A lot of paper on Bastrika, Pranayama, and Brahmari Pranayama, and the cognition, mental function, cortical matter thickening, all those things. Plenty of study available. As I was telling about Mula Bandha and the root lock method, and it improves the pelvic floor muscles. The Muladhara chakra, the first chakra in the bottom of the spine, as per yoga, our soul lies there. And there is a soul ventilation technique also available. So you keep the hand on the left hand on the umbilical level, palm facing upwards, right hand above that. You take a slow, deep inhalation, slow, deep exhalation. The breathing travel along the spine, touch the soul at the bottom of the spine, come back to the nostril. So it's called a soul ventilation or spine ventilation. You would have seen many sadhu sannyasis sitting like this in this position called Bhairava Mudra. You can do this in the chair position also. It's called chair yoga. In conclusion, yoga therapy is an additional therapeutic measure in preventing and treating medical disorders. In Parkinson plus disease, meditation, pranayama, simple asanas, mula bandha are beneficial. Thank you.
Thank you. Thank you, sir.
Thank you.